Healthcare systems are utilizing the lean methodology to manage change, find efficiencies, optimize resources, and increase team morale. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly, Senior Writer with AHA. In this episode, Rebecca Chickey, MPH, Senior Director of Behavioral Health and Field Engagement at the American Hospital Association, discusses lean methodology to improve hospital processes impacted by the COVID pandemic. Rebecca is joined by Brian Kay, Vice President of Continuous Improvement at Rogers Behavioral Health, and Dr. Patrick O'Malley, Medical Director of Primary Care Services at Rogers Behavioral Health. And now to Rebecca.
Thank you. This is Rebecca Chickey, and today I would like to welcome Brian Kay and Patrick O'Malley. I so thank you for joining us and for your willingness to talk to us about the importance of implementing the lean methodology to improve hospital procedure and performance during the COVID-19 pandemic. What I'd like to first do is ask you to tell us about your roles at Rogers Behavioral Health.
Thank you, Rebecca. I'm Brian Kay. I'm the Vice President of Continuous Improvement at Rogers Behavioral Health. In my purview and oversight, I work with our continuous improvement teams as well as lean facilitators in order to improve access to care, make sure that we're performing the best clinical effectiveness for the care that is delivered, and then have the opportunity and ability to work with individuals like Dr. O'Malley when we're faced with crisis to improve processes and respond to processes in a quick and efficient manner.
And I'm Patrick O'Malley. I'm the Medical Director of Primary Care for the Southeastern region for Rogers Behavioral Health. So I manage all the non-psychiatric medical services, advanced practitioners, other docs. So that's my role. I've been with Rogers for a very long time, since about 2003 at different capacities. And likewise, I enjoy working with Brian in we call it the Rogers operating system, our lean methodology, but it's similar. And I'm happy to be here.
Thank you both very much. And so just to repeat, when we say the word lean at Rogers Behavioral Health, they refer to it as the Rogers operating system. So just those are one and the same if we interchange those terms throughout this podcast. My next question, I assume the answer is going to be very broad, but if you can, could you describe some of the key challenges you faced during the pandemic, particularly as we head into its 7th month?
When the pandemic faced us, it challenged us organizationally of how to respond with speed in implementing new changes in a way that is not going to jeopardize patient safety, as well as continue to have our robust process and meet our organizational goals. So with the ever-changing guidance from CDC and locally with states, we had to find ways of implementing that quickly, in a sense. The other thing that we had is we are a very large behavioral health system where we've got 4 distinct levels of care. So we have inpatient services, residential services, partial hospitalization, as well as intensive outpatient. So many of those patients were programming on-site in our clinics. We had to flip on-site to telehealth in a very, very fast manner. It posed some operational challenges, it posed some technical challenges, but all in all, we were able to flip close to 1,000 patients from in-person treatment to telehealth in a matter of 2 weeks, leaning on lean methodologies.
Yeah, and I'll add to that. We've always, from the back when it started in April, we've always challenged ourselves to maintain patient access with significantly reducing risk, both to patients and staff. So everything that Brian just said, we had in mind doing those two things, keeping access as high as it can be while mitigating risk the best we could. So in the beginning, we implemented the lean methodology, the ROS system, to rapidly come up with solutions to those problems. And we achieved it initially by going virtual. In the regionals, almost exclusively in our brick and mortar type campuses, we managed to get about 50% of staff, any way we could to reduce density, people density, while at the same time maintaining patient safety and so forth. So, in the 7 months, so much has changed. In the beginning, we relied on it to get emergency type applications for the what ifs. We really didn't know how this was going to go down, and we had to be prepared for 50% staff, for critical staff levels. So we had all these things in place. So we were, in a very, very short period of time, we were able to not only deal with the now, whatever that now was in April, and then it changed again in June, and it changed again when all the kids went back to school, and now we have the cold and flu season coming. So there's all these what ifs. So it's allowed us to not only prepare for the now, but also be prepared for the what ifs.
So I'll add on to your what ifs, if I may, Dr. O'Malley, and that is, as you planned and you saw this unfold, what resources were most affected?
In particular to the lean methodology and the ROS, I'll just use my experience as someone who, and Brian had been living this already for a few years, and thankfully he did, because when this emergency came up, we were prepared for it. But as a doc, I really wasn't involved with it that much. I had participated here and there, when called upon, but I really didn't know the terminology and exactly how it worked and so forth. But I was able to see an incredibly efficient way to identify a problem and then identify solutions. And then, so that's just the first part of it, but then quickly implement it and not letting perfect get in the way of implementing it. And then the second part of it is the continued engagement that goes on. So we have huddles daily, we have metrics that we're measuring objectively daily, and it allows for an incredible amount of staff engagement in the fine tuning of it. So in the not only the monitoring of it, but the fine tuning of it and the continuation of it, it allows for great communication. It's just a very, very efficient way to problem solve.
And it was a way that we were able to roll out these new processes as fast as possible, getting the input of the people who are doing the work on a daily basis. So when you reference what resources were most effective, we completely changed our provider workflow very rapidly, and having their perceptions, having their input on what the new workflow was able to do helped mitigate some of the stress or the anxiety that was created around that as well. The other interesting thing is we've been only in the lean business, I would say, for the last 4 years. So we're relatively new on our lean implementation journey. So we systematically started working on lean Kaizen events, and then we implemented a daily huddle system about 3 years ago. So our lean facilitators were very much affected through the change with COVID, focusing on utilizing the tools in a more broader business system sense, not only in a pure process improvement standpoint.
So let me build a little bit on, I think, Brian, what you just said, and that using the lean process, if I heard you correctly, had a positive impact on the well-being of Rogers behavioral health staff. Would you say that is true? And can you extrapolate a little bit, if the answer is yes, on the why?
Absolutely. When we implemented our lean system, we built it off of 2 principles. One is respect for people, and 2 is continuous improvement. So building a huddle system and building our rapid improvement events around that, when we were implementing it out, we always want to put staff, our patients, at the forefront. So there were so many unknowns that were rolling out with COVID. There were so many different communication channels. We immediately implemented staff huddles, not only on the unit, but with our medical staff, as well as a guiding group and a coalition. It helped bring a sense of, I would almost say community, a sense of awareness for everyone that was involved, because they were up to date on what the most relevant information was regarding COVID. They had a place where they were able to escalate issues or process issues they were seeing on their unit, and they had a group of support that they were able to bounce ideas off of. Dr. O'Malley, I don't know if you want to speak about how you structured your medical staff huddle and was able to build kind of that sense of community with that team.
Yeah, it's so whether it's and I participate at a lot of levels of huddles. So there's the medical staff huddles, but there's all these other different levels. And what it does, not only is it just a good form of communication, but it allows problems to be tiered up very quickly. So it allows people at a tier one huddle to tier something up. It allows for people at the tier one huddle to be heard at a higher level very quickly. Um, and I just again in the evolution of this and dealing with anxieties of staff throughout this whole thing, whenever there's a change, when we first implemented universal masking, and then we implemented the no visitors, and then mandatory eye protection, all these things, and we changed our isolation practices throughout this. Whatever change we made, even though it was done with the intent of staff and patient safety, it created anxiety. So, but this huddle system and this constant communication allowed us to deal with those anxieties through communication. We could hear what was going on at the ground level and address it quickly instead of letting it just kind of fester. What we found is the better that we communicate, the least anxiety there is.
And it allowed us to really pass down the reason why in many of these cases.
Right.
A lot of times, people have processes rolled out and they don't understand why or the reason behind it, and it creates issues. So the lean process and lean methodology provides such a good platform of being able to show the reason why and show and paint that picture so people could get behind it and be heard.
So we've heard a lot about the positives, and they very much are the positive. I mean, I just kept thinking to myself, you gave the staff, the frontline staff, a voice and a way to be heard, and also the return process to be able to explain why. But there had to be some unique challenges and barriers. Can you say a little bit about those, and if you overcame them, and if so, how you overcame them?
So I would say still probably the largest challenge that we are dealing with today is change fatigue. If you look back over the last 7 months, it's unbelievable how much we've changed our business in response to COVID. Telehealth, cleaning protocols, behavioral health hospital doing probably more isolations, Dr. O'Malley, than we've ever had in years in that way. So dealing with change fatigue with our staff has been definitely one of the largest challenges. We're very fortunate that we actually have a group that's dedicated to compassion fatigue and how to deal with these changes on a daily basis. So we've leveraged them quite heavily to be able to work with our teams and help them out in that capacity. Dr. O'Malley, if there's anything you want to add to that.
Yeah, I'll just add that yes, one of the biggest challenges of this whole thing and what lean allowed us to do was the rapid changes which led to fatigue, and then continued changes which leads to more fatigue. But at the same time, that whole process is what's solving the problem. So it's that ongoing communication, it's that ongoing, and it's engagement's a better word. It's keeping staff engaged. They're part of the process, they're part of the solutions. And as Brian said, it's allowing us to let them know the whys in a very rapid way. So, but that engagement is really the key. It's not just communicating. It's not just me doing an intra hospital wide webinar to them. They're actually engaged in the process, and that's, I think, the key to this whole process is staff engagement and continued engagement. So that's actually, yeah, it's allowed for a lot of fatigue because we're actually making changes, but they're necessary changes. But it's also the solution too, is the engagement.
The other challenge from a business standpoint too, and as I alluded to a bit earlier, was we had to upheave our current state of affairs to respond to the pandemic. So with the lean methodology and a lean-based business system, we plan out all of our improvement events over the course of the year. We've got currently 7 different value streams, so high-level buckets of work that we plan for. This put a little bit of a wrench in the plans, but oddly enough, it allowed us to have capacity to be agile, to respond to the different needs of the pandemic. So yes, it was a challenge, but it also provided us a very unique opportunity to have resources dedicated to change the process.
So as we begin to wrap up the podcast, thinking about those listening, can you answer 2 questions? One is, what are the best lean resources that you have seen, read, and utilized in this process that someone listening to this might be able to go out and find? And relatedly, if other hospitals are interested in going on this journey, what's your top 2 pieces of advice? How do you get started? What do you do?
From a resource standpoint, I am a big follower and reader of anything that's coming out of the Shingo Institute. I believe their whole methodology and the way that they look at lean integrated in the business system really fits and is in line with healthcare in a way. It's really the model of how do you want people to act and how to fit in their behaviors that I think really helps bring a little bit of premise to lean. For some of the top 2 learnings that we had, or top 2 things of people implementing lean, it's a never-ending journey, and I say that in the best way possible. Even though we've only done lean for 4 years, we're much in the beginning of our lean transformation. I think that's what makes lean so interesting too, is there's an endless amount of learning that you will experience over the course of time. And the other thing is, don't let perfect get in the way of better. I think that played out so critically in the pandemic, where we were operating on the knowledge we had today, but designing our processes that they could be flexible going forward in the future. So for hospitals that are looking to implement lean, it's worth giving it a try and seeing how it evolves over time.
And I'll just add, as a non-lean expert, but someone that's been incredibly impressed by it, it really is an incredibly valuable tool. I didn't really see it before the emergency pandemic, but I definitely see its value now. But if a hospital is looking to get into this, just remember that it does require some planning as far as staff goes. It requires staff engagement, and that's a little bit of a burden on units, on departments. If people are devoting their entire week to a rapid improvement event, they're not doing their normal job, so people have to pick up that slack. So it's really important that staff be part of the process, but there has to be the planning part of it too, so that the hospital can still operate effectively. But again, as someone that has been working with Brian, and I've learned so much from Brian in the last 7 months on this whole process, I don't see how we could have done this so successfully without the lean methodology, the ROS system, as we call it.
Well, Patrick and Brian, thank you so much for your insights today. I know that those listening to this podcast are going to take away huge chunks of wisdom from you and inspiration to consider taking their own lean journey. And so that concludes today's podcast.